Periodontal disease and diabetes. What is the relationship between periodontal disease and diabetes?
Fun facts about periodontal disease and diabetes. We already know that smoking is the leading risk factor for periodontal disease, but other systemic risk factors, such as genetic factors, age, gender, or systemic conditions, can predispose clients to develop periodontal disease. Systemic risk factors modify or amplify the host response to microbial infections and can increase the susceptibility to develop periodontal disease. In Canada, diabetes is one of the most common chronic diseases. In the year 2020, there were 3.7 million Canadians diagnosed with diabetes, excluding gestational diabetes. The World Health Organization recognizes diabetes as one of the major public health challenges of the century. Men are more likely to have diabetes than women, and socioeconomically challenged individuals are at a higher risk of developing diabetes. Diabetic individuals are at greater risk for developing periodontal disease than non-diabetics at a greater severity and rate of progression. Those with uncontrolled or undiagnosed diabetes are roughly 3 times more likely to develop periodontitis than those with controlled diabetes. Diabetes leads to a hyperinflammatory response to biofilm and impairs the host response, leading to accelerated destruction of the periodontium and delayed wound healing.
Advantages and disadvantages. So for advantages, number one is comprehensive oral care. With clients who have both conditions, dental professionals are expected to provide comprehensive oral care to better manage periodontal disease and diabetes. And clients with diabetes are aware of their glycemic management, so therefore, periodontal disease is more likely to be in control. This also conclude that they have better overall health that can lead to a positive outcome. Secondly, prevention and early intervention. So dental professionals are more aware of possible early signs of periodontal disease with clients who have diabetes, and alternately, as a result, preventative measures are considered, then progression is terminated immediately. Third, client education and awareness. So clients better understand how to properly care for oral and systemic care, since they can link the oral cavity with their overall health care. Disadvantages. Number one is that it can be a complex and expensive treatment plans. So clients who have both conditions may experience complicated and high cost treatment plans. Clients with periodontal disease needs 3 months of regular checkups and in-office dental cleanings. And then if they are diabetic, medications and monitoring equipment are also required. Lastly, um, they have difficulty in clients' adherence. So not all clients are able to keep up with required treatment and care routines, and one condition may be neglected.
Advance advances in periodontology relation with diabetics. Clients who present with diabetes have a greater risk in developing periodontal disease. Therefore, it is so important to maintain metabolic control of the client because periodontal therapy can have an impact on the HbA1c levels in the blood. This is when an adjunctive system antimicrobial treatment needs can effectively assist in this common complication. The systemic treatment effectively improves the client's periodontal condition, systemic inflammation and glycemic control.
Uses today. Understanding the connection between periodontal disease and diabetes allows dental professionals to provide more comprehensive care to clients. The link between these conditions can impact the client's overall health, and it's important to address both while providing dental care. The current approach to managing systemic connection between diabetes and periodontal disease include client education, customized treatment planning, and interprofessional care. Client education. Clients with diabetes are at a higher risk of developing periodontal disease. Dental hygienists must educate clients on proper oral self-care techniques, the link between diabetes and periodontitis, and provide dietary counseling that will benefit the client's oral health and blood sugar control. Client education can help maintain or improve the state of their oral health. Interprofessional care. Collaboration between medical and dental healthcare professionals can improve care for clients with diabetes and periodontal disease. They can work together to create treatment plans that address both conditions and utilize referrals based on the client's state of their condition. Customized treatment planning. Clients with diabetes and periodontal disease require more customized treatment plans. The status of their condition and blood glucose levels should be monitored at every appointment. Clients with diabetes may also require more extensive periodontal therapy, such as scaling, root planing, and antimicrobial therapy.
Future directions. So for screening, many patients visit their dental office more frequently than their physician, which puts us as an oral health professional in great position to detect early signs of undiagnosed diabetes and to monitor the health of those already diagnosed. As dental professionals, we play a key role in early diabetes screening. Poor screening is a major reason why so many people have undiagnosed diabetes. It's crucial for medical and dental teams to work interprofessionally to manage both diabetes and periodontal disease effectively. Children and adolescents with diabetes are more likely to experience greater attachment loss than those without diabetes. They should be checked for periodontal issues early and receive preventative care. We also need to be alert of the signs of poorly controlled diabetes, such as reduced saliva, abscesses, cheilosis, a burning sensation in the mouth and tongue, and frequent deep pockets, as well as checking if the blood glucose levels are in optimal levels of between 3.9 mmol per liter and 11.1 mmol per liter prior to any invasive dental treatments that can help prevent medical emergencies. Education. A study of dental patients with diabetes revealed that 85% of dental patients with diabetes never received information about how diabetes impacts the oral health, and 83% were unaware of this connection. Educating patients about this link is crucial because it can lead to serious oral complications besides gum disease, such as cavities, abscesses, fungal infections, and dry mouth. Elevated blood glucose levels can increase the amount of sugars available to the bacteria in the mouth, leading to more cavities. Abscesses can develop due to the gum's heightened response to plaque that potentially can cause alveolar bone loss. Dry mouth is common in poorly controlled diabetes, can increase the risk of oral candidiasis and cavities. Additionally, people with high blood glucose or on antibiotics are more prone to fungal infections. By educating patients about these complications, we can help them focus on prioritizing their oral self-care. We should demonstrate effective daily brushing and flossing techniques, such as alcohol-free mouthwashes and fluoridated toothpaste, and recommend xylitol products to manage dry mouth. Encouraging patients to schedule more frequent dental checkups and cleanings will help manage or prevent further oral complications. Furthermore, patients should be advised to report any signs of gum disease, such as redness, swelling, bleeding, dry mouth, loose teeth, or any unusual lesions at their dental visits.
So, interesting information. Periodontitis and diabetes are common, complex, chronic diseases with an established bidirectional relationship. That is, diabetes, particularly if glycemic control is poor, is associated with an increased prevalence and severity of periodontitis, and severe periodontitis is associated with compromised glycemic control. Periodontal treatment has been associated with improvements of glycemic control in diabetic patients with reductions in HbA1c of approximately 0.4% following periodontal therapy. For these reasons, management of periodontitis in people with diabetes is particularly important. The dental team, therefore, has an important role to play in the management of people with diabetes.
And that sums up our presentation for today. Thank you.